the rest of your career is you simply put it over there. All of a sudden they feel safer.
Yeah.
These are kind of small towels because we're kind of cheap. But it's usually a little bit bigger. And then we just tuck it in the underwear and everything, and we pull it down how far? Usually to what we call the vertical fold. So once you see the vertical fold, you're good enough. That tells you you're clearly on the coccyx. Once you see the vertical fold, that's the start of the coccyx. So that means there's the sacrum. Now, we know that's S1, right? So there's the sacrum. So then we can, where's my pen? Here's the beginning of your coccyx. And this is FYI what I'm showing you now. And
So for lab, do we have to draw?
no, I'm just trying to, you're filming, so I'm demonstrating.
So we're slow Melinda in there.
Good? Her iliac crest is way up here. People think, oh wow, that's good. So now here's the low back. So I'll have a pad here, a pad here, a pad here, and a pad here. And that's my low back. It's a very small area.
So would you use small pads because it's a small area?
Well, if it's along the spine, I would. What if it's
Muscle.
across the whole back? Then I might use an oval here, an oval here, an oval here, an oval here. Especially if it's gate theory. I don't have to go deep, so I'm not worried about the pads being close together.
Wait, this is about lecture.
That's electric.
Okay.
Delete
Stuff you
that
don't
part.
need to know. Yeah.
Cut it out.
All right, so we're good on that? The next thing is you're going to see, I don't know if you can see it slightly, you gotta kind of look down like this. You can see a little dimple here and a little dimple there. Do you see that? That dimple is usually there, but not always. That dimple is right over the PSIS. So we're going to put our fingers into the dimple, but that's not a good landmark. So what we're going to try to do is trace the iliac crest back to the PSIS, posterior superior iliac spine. But I'm going to show you how, where it is. There it is right there. Do you feel that? So now I'm going to trace it back. The iliac crest goes up and around. So to give you an idea.
It's dry erase. It's okay.
Yeah, it's water.
It's about Halloween was yesterday.
Soluble.
And what does that look like?
That's all.
Exactly.
What?
What?
What does it look like? What does it look like, guys?
Everybody has those implants, right? Most people have them. So I
What's it look
bind
like,
it
Rob?
back, and there is my
Didn't you hear
posterior
me?
superior iliac spine.
The thong,
Right in the
thong,
dimple.
Oh,
What?
she's got it. Okay, got it.
Now, it says the SI joint. We're not going to actually be palpating the SI joint, the sacroiliac joint. We're going to be palpating, there's ligaments that go right across here. It's called your posterior sacroiliac ligaments. Those hold your SI joint very stable. Females have more trouble with these joints than males, especially pre and postpartum. It's right before, during, and after pregnancy. Because they expand. And so then they start shifting around, and then this side rotates or flares, up slips, down slips. If they fall on their buttocks when they're pregnant, ooh, that's not a good thing. So this will be palpating the joint space, like we'll be palpating the ligament. If this innominate, or side of the pelvis, is rotated or flared or up or down, that will be extremely tender. It won't be tender on her at all. So all I do is I come to the posterior iliac, superior iliac spine, or the PSIS, and then I just drop medial and I push in there and I say, how's that feel, Kristen?
Fine.
Go to the other side. How's that feel, Kristen?
Fine.
Because the ligaments go this direction. And if there's no pain, we don't suspect anything being a problem in that area.
From PSIS medial, right?
Yes, so here's the PSIS, just medial. Then the ischial tuberosities. Our landmark now is going to be the gluteal fold. This is the gluteal fold right here. Simply take your thumbs right in the middle of that gluteal fold and push up, and you push right into the ischial tuberosity. Good? Now that's a good bony landmark for the attachment of what muscle group? Hamstrings. Do you see how knowing your osseous landmarks? That's an obvious bony landmark, so if I go there, I know that the hamstring tendons come off of that. I simply go below that, and I say, all right, don't let me move you. And oh yeah, there's the nice big tendon, but that'll be later. Good? All right, let's give those a try.